Welcome, everyone. Thank you for coming to our Lunch and Learn, the Florida Asthma Coalition Home Visiting Work Group Lunch and Learn webinars. We are going to wait a couple minutes to get people admitted into the room, and we will start shortly. But thank you. Again, thank you for being in here. Probably just until it is 12:03, and then we'll start. Okay, it is 12:03. So again, thank you for coming to our Lunch and Learn from the Florida Asthma Coalition Home Visiting Work Group. We welcome everyone, and we welcome our presenter, Mr. Ken Peach, who is the Executive Director of the Health Council of East Central Florida. I'm so used to say Southeast. The health planning organization for Brevard, Osceola, Orange, and Seminole counties. He serves on the numerous local health planning boards. Ken's career has included hospital, association, physician office, and nursing home management. Additionally, he has owned and operated commercial radio stations and a health insurance agency. Ken has an undergraduate degree in communication from Seton Hall University and an MBA with a concentration in health administration from the Florida Institute of Technology. Ken has been a member of the Florida Asthma Coalition for a long time, and he's a very valuable member of our coalition, bringing all kind of ideas to all the the projects that we do. And with, as we know, it's just our mission is just to gain asthma control and help all the residents in Florida living with asthma to live a healthier life. So Ken is going to do his presentation, and he has requested, if you have a question during the presentation, you don't have to wait until the end. We have a time allotted for that. But if you have a question, you can put it in the chat, raise your hand, and he will be very glad to answer that question. So without further ado, Ken, thank you.
Wanted to thank you, and I appreciate the invitation to this today and the nice introduction. It was like two. There's three fundamental learning objectives today. One is really to become aware of the presence of radon gas in Florida And that was maybe a bit of a surprise, because when I talk to most individuals, what I get from them is, oh, we didn't know we had radon in Florida. And if you look at the map, as we will later on in the slide set, we'll actually have a chance to see the impact that it has compared to the rest of the country. And it is less, but it is a problem here. And that's one of the things I like to discuss today is, why do we think we have that issue? The second would be to learn how radon gas screening and testing is conducted. Most of my slides focus on the individual home itself, but there also are mandatory requirements, and we'll talk about what those are. And then understanding the elements of the mitigation system. What is it that you can do to actually make an impact on this? And let me just as an aside for a moment, Shelby, I'm still seeing the lead slide. Has it changed, or maybe it's just my computer that's not changed? There we go. Okay. In sharing that, I also wanted to say I have no conflict of interest to declare, but I really would, as Wanda mentioned, like to make this a discussion, because I don't like, so many of these webinars sitting there reading the slides to you. I don't want to do that. I'd rather let's talk it as we go through. But I will share with you just briefly how we got involved in this. We, meaning the Health Council of East Central Florida, aside from our membership in the Florida Asthma Coalition, we developed a paramedicine program using paramedics and a non-EMS approach to care a few years ago. And we also are the administrators for 7-county regional cancer collaborative in Central Florida. And we were challenged last year to look at the area that we were serving and identify a way to impact one of the 21 elements in the Florida Cancer Plan for 2020 through 2025. And I was actually in the mall food court sitting there looking through, and radon popped out. And I was so surprised that it was an objective in the state cancer plan at the time. So recognizing that, we said, well, we have people already in the homes. So how do we make this work? What do we need to learn about radon? And what we learned is what hopefully I'll be able to share with you today as we go through, because again, it's an area that surprised me in terms of the numbers and statistics. So let's talk about radon gas first. And Shelby, if you go to the next slide. So really, radon, as you can see by this diagram, and let me share also at this point in time, all of my diagrams, all the pictures I could find are of 2-story homes. Because again, as you'll see on the map, this is a major issue in the northern states, more so than we think down here. But if you notice, the leaks that are occurring in this case into the basement certainly are also linked leaks that can come through the foundations we have. You may all know, and I've certainly experienced, that the settling that goes on in much of Florida, where we pour a flat slab and eventually you get cracks in that slab. And if you'll notice here, the radon is coming up through the soil. It's also coming in through well water, if you've got a well. It's coming through the windows. It's coming through the water system. There are just so many opportunities. So if you'll imagine for a moment that this house is sitting flat on the ground, you still have all of these ways that radon gas can slide into or can get into a home. Let's go ahead to the next slide. And this is the map I was sharing with you. And incidentally, as Shelby, I want to know, I can't see if somebody does put their hand up. So please, by all means, feel free just to interrupt if she sees that, just open up so you can speak about it, so we can discuss it. But it is a carcinogen, and the leading cause of lung cancer, second leading cause. And I was amazed, 21,000 cases in a year throughout the United States. But you'll notice again that we're in zone 3 for the most part in Florida. So you'd say, well, it's a problem up north. Now, having grown up, and I don't normally say this because I've lived in Florida since 1983, but having grown up in New Jersey, we kept our windows open. So the breeze were blowing through the house a good portion of the year. And at that time, we didn't know much about radon, that there even was a risk. But either way, we had that fresh air flowing through the home. I suspect that one of the issues that we have, and the reason for the problem here in Florida, is that we seal our homes so well. With air conditioning, we try and keep everything inside. And I don't know how many times your windows are open. Mine are not open for the most part. And so what we're doing is we're basically capturing a good portion of that radon that might be seeping into the building in the home and not letting it blow out and get away. And this, according to the statistics, is what causes the concentration that we have of radon gas in the home or in the building. And that's the thing that we have to be most cautious about. So it is a modifiable risk, though. There are ways to do mediation for the problem, and we'll talk about that as we go again a little bit further. So let's take a look on the next slide. Again, the presence of radon gas. And is it a problem throughout all of our counties? Because obviously this being the Florida and not the Central Florida or South Florida Asthma Coalition, how is it impacted? And I was not able with the slide to give you all the answers for all of the 67 counties, other than to say that, again, according to the state statistics, 1 in every 5 tests are found to be elevated. And according to the statistics from the Florida Department of Health, those elevations are at the risk level of 4 or above. So they're definitely an issue and something that we should be looking at. You'll notice that it varies. And again, some have very low and some have very high radon levels, but they have been reported from all components or all portions of the state. And so what this does is it gives you an idea from the active, the passive, or the generally, unnecessary. What is it that you need to do in your particular county? I will share with you that we've gone through our service area, the 7 counties that we serve on our cancer collaborative, and we've actually mapped by zip code. You can get the zip codes from the Department of Health, so you know exactly which zip codes are at the highest risk. I just brought this back to a protection map because we didn't have that much space in this presentation. So do take the time, if you'd like to see what your zip code looks like, to go search for that through the Department of Health website. Let's go to the next slide. I mentioned, incidentally, again, that the suspicion, according to the Department of Health, is that the buildings themselves hold the gas and therefore it's concentrated. But I'll also share with you that when I was first approached about doing this presentation, I was a little confused because I thought, well, radon, and then we're talking about asthma. And indeed, when I went out to look at this, the EPA said there is no evidence that respiratory diseases like asthma are caused by radon exposure. However, if you look down under remediation, radon does not cause the attacks. However, it can aggravate and be detrimental to health when you have that radon concentration in the home. So that was, I believe, the reason that I was asked to share this information with you today. Any questions so far? Love to have a discussion on some of these things. All right, well, let's go to the next slide, and we'll talk a little bit about the radon risk if you've never smoked. So this gives you on the left-hand side the radon level. And I mentioned to you that a 0.4 or above is what you have to be cautious with, or 4 and above, I'm sorry. And you'll see that about halfway up there. So you'll see where it's fix your home is the solution, and we're going to talk about how that's done. You can also see that, if 1,000 people who never smoked were exposed to this level over a lifetime, and you get an idea of what the impact is. Now, this, again, is related to lung cancer as a direct concern, but certainly, as we've talked about, aggravating individuals who have asthma already is a side impact of this. And then you can actually go ahead and look at the comparison to the impact of these higher levels of radon concentration in the home. And just so you know, it's called picocuries. So if anything above 4 picocuries is what you have to worry about. And we'll talk about what to look for when you're doing testing in your home in terms of what are the, how do you go about accomplishing that. So let's go to the next slide, and we'll talk about the radon screening and testing. So I had my home tested when I was first looking at this maybe a couple of years ago, and I went to one of the hardware stores and I bought the little test, and it's the test kit. You put it in place. It tells you where to place it and how to place it in your home. and this would certainly apply to any location that you want to test. You leave it there for a period of time, and then you take the test material, put it in the mail, send it out, and they'll give you an indication of what your level is of exposure in that particular part of the house or in that particular room. And there are electronics ways to measure this too. We'll be looking at that a little bit later. But one of the first things that we identified when working on putting our radon program into place was we could not do radon testing. And the reason is because the Health Council and our paramedic program is not certified by the Florida Department of Health. There are testing firms. I'll show you in just a slide or two what that looks like in terms of the listings that you can get, again, from the Department of Health's website on this. But these testing firms are certified to do this kind of testing. However, for you to go ahead and do your own test in a home is fine. It's just there are certain homes that do require mandatory, and we'll cover those as well. If indeed your screen indicates that you're at risk of 4 and above, then the next thing to do is to check the list and find a testing firm. Those testing firms then will come in, they'll do the actual testing, scientific testing for the radon exposure, at which point in time then the mitigation firms are also certified. So these are firms that know what to do to modify the structure to reduce the danger of that concentrated radon gas in the home. Next slide. Oh, and I do want to mention too, you can request a kit. You saw that over on the left-hand side from the Department of Health. There are free kits. This one, First Alert on the left, is the one that I was aware of that I purchased for my home use. And I was very glad to see, I think I was at 1 or less, as I recall, when I got the results back from the test firm. Related to our paramedicine program, we decided to go ahead and purchase something other than the test kits. And we purchased the devices on the right, which are available for, I think they were less than $150 each. They're an electronic device that, again, measures the radon presence in a home or in a building. So what our paramedics do is they place that unit 1 week, and then when we're back in seeing the individual the following week, we check and determine what that is, and then we kick a protocol into place in terms of what we're going to do about it. But certainly if you want to check on a regular basis, the devices are very small. That's probably well, fits in the palm of your hand and just runs on a couple of batteries. So those are the options. Now, again, these are good screening options. This is not the certified testing process, but at least gives you an idea of what your radon presence may be in your particular structure. I think, did we have any questions? I saw some box come up a few minutes ago. Shelby, anything, or Wanda?
It
Yes.
looks like, oh,
Go ahead, Shelby. Go ahead.
It looks like in the chat, someone asked where they can find the link to look up their zip code for radon testing.
Oh, okay. And of course, I went through, found it, and I don't have it with me. What I would do is go ahead. It is the Department of Health. I would go out to the main Department of Health website and just Google zip and radon, in the search box, and I think you'll find it that way. I should have made a note of that. There are some references at the end that may be in there, but I don't think it is. I think I was just working off the site in general. Looks like somebody may have found it already.
Yes, we have our folks from the Department of Environmental Health from the DOH, and so Tim Wallace is providing that information. Thank you, Tim.
Yes, thank you. So let's go ahead to the next one in terms of what it is to do the radon screening. The next slide. So, one of the things they want you to do is make sure that you place this properly. We talked about this, and that's measuring in your basement or the lowest level of your home, but about 3 feet off the ground. I actually put it on a table in the middle of the room. They want you to keep it away from windows or other things that may disturb the gas concentration. And also a lowest unit, because in all likelihood, that's where you're going to see, if you remember the diagram showing the gas coming up from the ground, the lower level is going to give you more information than putting it on the second floor of a home, for example. They like to have it short-term testing. It says 2 to 90 days. No one would be using 90 days, but and long-term testing more than that. Generally, they recommend 3 or 4 days. We're doing 7 days with the unit placement in the homes as part of our project. And once you've completed the test, again, if you're using the device, the electronic device, you'll know right away what the answer is. And if you're not, if you're using the paper or the cardboard testing one, then you'll get the results sent back to you once you've submitted that information. And we'll go to the next slide. So I mentioned again that you can use screening, and we call it radon screening, using those devices. If you need to go to testing or you wish to do a test, then you do have to go ahead and look at one of those that are certified. So there's the website on the right-hand side shows you, and there's a list by the service area or county for these licensed or certified, I should say, inspectors. For mandatory testing by certified testers, that's required for public and private school buildings in the state of Florida. It's required of 24-hour care facilities, foster care, state licensed daycare in select counties. And again, you will find when you look at that on the website, you'll find whether or not the facility that you're looking at in daycare is in one of those select counties. It also gives you the interval of how often you should be doing this based on the concentration level. So this is not something you have to be doing monthly by any means. You do it and you have a period of time before it's required again, unless there is a modification made to your building. So if you indeed are adding onto a building or making some change. I do remember a number of years ago, quite a few years ago, building a new home, and we decided to go ahead and add an extended aluminum porch to the home. And they told us at the time that because the slab had been poured, but it was not poured with the protective in it, that we would not be able to ever seal that particular screen porch. So again, any kinds of modifications and buildings, you'll want to take a look at that, because it does change whether or not that concentration can occur, or whether it's been occurring or might occur with the changes that you make in the building. There's also an excellent do-it-yourself measurement recommendations chart, rather, that's available through the website, that tells you, based on what you find, what level of concern you have at any one time, what type of long-term follow-up test might be required, or short-term, and where mitigation is either considered or recommended. So again, a lot of useful resources, and this is just on the Florida Department of Health site. This is not counting the EPA and others that also make a great deal of information available to refer to. Let's go to the next slide. So once you've identified that you have a risk, then what do you do from the standpoint of making to do something about that? And so you can see here the recommendations are protecting occupant health. So as soon as you've gotten that 4 or above, that's something you should probably consider. Retesting periodically, and just to make sure, even if you're below, it's a good idea, again, if you have some concerns, to go ahead and check. But anything over should be mitigated as quickly as possible, or reasonably as possible. And if we go to the next slide, we'll look at the 5 common mitigation elements that are involved in this. Again, I couldn't find a one-story home, but if you look at the recommendations, so one of those is to have that gas permeable material under the foundation. So as I was referring before, when we had the concrete poured for the metal aluminum porch on that particular home, we didn't have it sealed. So it was never a safe area to seal if we had ever decided to take down the aluminum and make it and add it to the house. We would have had to make some modification for that. So putting some type of sealing base in there to protect the radon gas, rather protect the foundation. Another thing is caulking. Make sure that you have the caulk to try and keep the cracks from the home, the settlement cracks and others, from allowing the gas to enter. You'll also see that there is a way to mitigate by literally taking a pipe and putting it up as a vent pipe to allow the radon gas basically to enter, go up the pipe, and then exit without actually entering into the home, which is also one of the recommendations. The electrical junction box for installation of a fan, the idea of putting a fan up in the attic so that if anything is accumulating, that fan will take that gas out as well. So those are just 5 of the recommendations on what would be a passive radon resistant system. And some of these things are fairly easy to do in your home. Some of them are not, but these are the things that will be shared with you by the licensed and certified mitigation companies when taking a look at what needs to be done if your home shows at that level of 4 or above. Next slide, please. So I mentioned at the beginning that our paramedics are doing this. FLASCO, the State Oncology Association, funded a grant to go ahead and begin to help us identify the radon exposure and with cancer patients, but we then also received a grant as a regional cancer collaborative, and those funds are being used on a large scale. So we're actually doing over 80 homes that we are testing, and what we're doing is we're asking individuals in those homes if they would mind if we do this for them. Particularly in the high-risk zip codes. Right now, we're focusing on 3 zip codes in Seminole County, which showed a very high percentage of radon in those areas. We had purchased 6 of these electronic devices, and we will begin to get outcome results in early 2024. Just to share with you, and again, keeping in mind this is an asthma coalition program, but just to give you an idea a little bit on how we're doing this. So in addition to getting the approval or from the homeowner, the willingness to participate, once we have the reading, if there is a high level of radon concentration, we go ahead and share with them the list of certified testing companies that can assist. We also provide them with an EPA booklet on remediation models for radon gas. And then we check back with them 90 days later to find out what they've actually done about it. And this is why our results will be announced in 2024, because we're in that waiting period on a number of individual homes. Because while we want to make them available that we have the issue, we may or may not at that point in time have an indication that the homeowner is actually doing something about it. So for our test purposes, we want to make sure, and they know that someone's going to be calling them 90 days later to determine what it is that they've done about it to reduce the likelihood of a problem in their home. Our goal with this was not only to be able to implement the program now in the homes of individuals that we're visiting anyway, but also then to expand it. Because at the cost of about $150 per electronic testing unit, you may be aware that there are initiatives really statewide now in terms of increasing the numbers of community paramedicine services, primarily run by fire rescue services throughout the state. And so that the simplicity of adding this device to the equipment that they have for individuals, so as they're doing what they do as community paramedics and trying to reduce the number of individuals that are frequent flyers into the hospital, they would also be able to offer this service at no cost at the same time. So our hope is that based on our results of this current pilot, we'll be able to make some expansion and see the program grow elsewhere in the state. Which certainly, again, would not hurt if we look at the fact that this could be a contributing factor to asthma issues. Let's go to our summary slide here. So, in summary, really, what is the awareness of the radon threat? And I think, again, there's an opportunity in January, because in January, nationwide, it's National Radon Action Month. So the fact that we're almost into November makes this a great time to just raise awareness and perhaps to be able to use some of the public service materials that, again, I'll give credit to the Department of Health. It's on their website. Pull some of the public service announcements down, the flyers and materials, and share that there is this radon risk that is in Florida, despite our thought that it's only in states up to the north. The second thing would be to conduct the screening. And again, I've given you the two home models that are there. The lab kit, which is the kit that you can get from most of the large, big hardware stores, and or the electronic version if you decide that you want to do this on a more regular basis and want to be able to have a device to be able to help do that. And then, of course, I also want to share at this point in time that, again, if you were on the list of those entities that are required to do this, they have to use the mitigation firms to do that. So the screening really should have a third box here, and that would be the mandatory testing services for the mandatory test buildings that we mentioned before, schools and so forth. Then the conducting of the testing itself, a few days of having the material exposed or the electronic device exposed and properly placed in the home or in the building, again, about 3 feet or so off the floor, center of a building, away from windows. And then for those with a risk factor of the 4 picocuries or more, the mitigation process, letting individuals know something has to be done, should be done, getting them the materials and the resources to help them identify what is it that they have to do. And then if you're doing this as a campaign, as we are, just finding a way to check back at some later date and determining whether or not something was done. You might be able to talk them into doing something at that point in time, but if nothing else, you have an idea of the effectiveness of your campaign. And we'll go to the next slide, Shelby. And I mentioned here the resources. So you do have the link there for the Department of Health, the cancer plan. It is objective number 9 in the Florida Cancer Plan is to do something about radon. Healthy House Institute has some really good information. And then you'll see the EPA, CDC, and Atlantic Radon, which I believe actually is a mitigation company, but they were one of the ones that referenced and addressed asthma in their information. And I believe that is my last slide other than questions. So I know I was asked for 45 minutes. I am ending a little early, so I hope you don't mind, but it does open up an opportunity for questions. And I appreciate the opportunity. And believe me, it's been a learning process for me as well. Even just preparing for today's materials, did a lot of research on it, and I appreciate the opportunity to join with you today.
Thank you, Ken. Very informative. We have several information and links from our fellows at the Bureau of Environmental Health. And so there's a link for radon test kits in Florida, the certified business individuals. So Dr. Weiss.
Yes, thank you. I wanted to thank you, Ken. That was excellent. I'm sorry I had to come in late. My teaching schedule changed this semester, and I now teach till 12:15 on Wednesday, and now I'm on my way to another job. But anyway, thank you so much. I think this is an under-recognized threat, and it's always good to call attention to things that people might not be aware of that could really impact their health. So thank you so much. I'm going to look at the first part, which I missed when I was still teaching. And of course, today I tried to end 2 minutes early, and 3 students came up to me with questions immediately. So I didn't wind up ending early, but thank you so much. And I wanted to say to the group, it's been a pleasure being the co-chair of the home visiting work group. I am stepping down at the end of December, both as the co-chair of the home visiting work group, but I leave it in the capable hands of Dr. Wanda, and also as the co-chair of Florida Asthma Coalition. So it's been a pleasure working with all of you. I'm not sure if I'm going to see you before the end of the year. Hopefully I will see you in November, but I just want to take this opportunity to say thank you, everybody.
Thank you, Dr. Weiss. And it's kind of following up of what Dr. Weiss was saying. It's a myth. One of the myths about Florida being, a peninsula floating basically on water, that we have no radon issues. And I know that for, discussions that we have had before, that even on high-rise buildings here in Florida, we can find elevated levels of radon. It doesn't matter that you're, flat on the ground, because it's a gas, it could trouble up. So just be aware. I mean, even though we don't have a great association with asthma, but it's still an irritant. And so some of us that we have this twitchy airways that get irritated, by whatever we can breathe. So we will definitely have, radar in our minds, and radon, not radar, sorry, radon in our minds, so we can be proactive. I did a radon testing in my house last year and came out negative. No, no radon detected. So now I'm just like I can breathe a little easier. I mean, I live in a one-story home. I don't have wells or anything like that. But hey, you never know, because we know that everywhere, here in Florida too, some things are built, years ago, decades ago, on land that might be contaminated with something, and that something could be radon. So I don't know if you Tim or Chris, do you want to add something to this discussion other than what you have put in the chat?
I think it's a great overview, really, really nice presentation. And I agree, we need to bring more visibility to it. When Tim and Michelle and me and my communications person, Diane, when we do events, we do try to hand out the free test kits, and people are always really interested. They love the idea of free. And yeah, a lot of them haven't really heard about radon as a risk in Florida. And even, some people moved from up north and thought, oh, what's fine. But you just never know until you test. And, Tim and Michelle know a lot more than me, but while it's good to have that zip code level data available that you can look up, it's definitely not random sampling. I mean, some years ago when we looked at it, the zip codes that have more testing seem to be the more affluent ones, the people that just are more educated, know more about the issue. So there's some self-selection going on there. So don't think you're in the clear if, the percentage seems low for your zip code, especially if it's based on a low number of tests. Yeah.
And I was going to say that we provide our radon testing data from the certified professionals and businesses to Chris's program, the Environmental Public Health Tracking Program, and they share that information with the CDC. And there's a big website on radon where they take all this data from all the states that provide this information. And I don't know if Chris, if you want to provide a link to your website or to the federal website, but that might be of interest to folks as well. It's all from the radon testing data that comes from the certified professionals. Michelle, do you want to say anything about that?
Thanks for pointing that out, Tim. So what that also means is all the free test kits that people do, those don't get reported in this same way, because we kind of consider those a little less reliable, more like a science citizen type thing. And very good points that both Tim and Chris made. Also, we like to remind people that yeah, when you see a county and it looks like, oh, maybe there aren't high levels of radon there, like Chris was saying, it just means that we don't have enough testing results there yet, or none that have been published on maps, or could be that honestly, we've found high levels of radon in every county, and we encourage every single person to have their home tested, no matter where you live in Florida. Don't just say, oh, well, I live in this low, I live in a county that says it's unlikely I'm going to have radon, so I'm not going to worry about it. That's not necessarily true. We recommend everyone test their home, because you just can't not know for sure until you test your home. Thank you. And great presentation. Thank you.
Yeah, thank you, Ken. We appreciate it.
Well, I've got so many experts on here. That's why I really wanted to make it more of a discussion today than a presentation. But, it's wonderful to have the insights of all of us sharing this together.
Hi.
Well, I'm sorry. Something. Who? I didn't notice. Who wanted to say something?
Sorry, Wanda, it's Olga with the Health Council.
Hi, Olga.
So I did have a question. Are there barriers that you've noticed that prevent homeowners from taking those radon mitigation measures, such as like cost conserved or concerns or like the complexity of mitigation? And are there like strategies or initiatives that have helped to address those barriers?
Again, we've got some experts on here, but I'll share with you that we're too early in this. So we're still in the testing. I did not have a chance, the testing screening. I did not have a chance to check with our paramedics that are doing this to get an idea of how many, and I should have, how before today, how many they've identified that are at higher risk based on the results of the testing. But again, we want to check 90 days later to see what they may have done. The EPA, as I mentioned, does have a booklet on remediation models, and we've talked about the fact that there are certified remediation firms in Florida. If you think about trying to stop gas and you think about the caulk that was done, sealing up cracks, but all of those things do cost something. So this is going to involve some type of investment, particularly if you look at the idea of having the pipe running through the home. And I mean, all of those would be expensive investments. On the other hand, if you know that you're living in a higher risk environment, I think it's one of those things that you would hope people would do what they could do to improve it. It brings an interesting question, Olga. I was on the board for a number of years of Rebuilding Together Orlando, which is the local chapter of a national organization that focuses on making healthy housing available to veterans and low-income individuals. You may know that there's an extraordinarily active chapter in the Tampa area, which now I believe is now running the Orlando area as well. And I don't recall at any board meetings ever talking about radon at all, but that was a number of years ago. And you would hope that that is something that Rebuilding as an entity now would begin to focus on, if there are ways that those who are low income or higher risk or veterans would be able to get some assistance in whatever remediation was required.
Yes, there's also, I was just looking, there's at the Florida Radon website from the Florida Department of Health, there's a map that has all 67 counties, and it includes obviously the counties that it's mandatory. So the mandatory radon testing basically includes all public and private schools, buildings with students K through 12, all state-owned, state-operated, state-regulated, or state-licensed 24-hour care facilities, and all state-licensed daycare centers for children, minors. So it kind of, the whole map is concentrated in the central Florida area, except Orange and Lake County. But anything around Marion, Volusia, Seminole, Sumter, even on the northeast, Duval County, Nassau County, Jefferson, Leon. I mean, there's a lot of mandatory testing, and that's one of the things that, even though this is a home visiting work group, but we have also the schools and the child care centers work groups, and we are stressing about this and helping these child care centers and schools that participate in our programs and our asthma-friendly programs, so they can comply to this. And, you just give them the important resources through the Department of Health, so they can do their testing and know about this. It's just not, we don't want to say, you got to test, you got to say, no, we want to let you know, yes, you have to test, but these are the reasons. Because having asthma and having this irritants, is something that we need to become aware. But also, even though lung cancer is not part of asthma, but that we work together, with the Tobacco Free Florida, also the Bureau, and so all the agencies work together to improve the health of everybody here in Florida and above, around us. So it's very important to know about this, and just to, as I mentioned in the earlier, that we need to be cognitive about this situation, about the radon, and not be complacent saying, we're in Florida, we don't have to worry about that. I don't live in New Hampshire, Vermont, those areas over there. But just, keep it in your mind that this is something that might affect your health and your loved ones in the future. Yes, Michelle.
Yeah, thank you. I just wanted to add to the question. It kind of asked if price might be one of the restrictions. And so I've been here at Department of Health for 2 years. And so I only have that experience to draw on. But I would say that in the case of mitigating radon in Florida, the parts where it's hard, it's in rental places where landlords don't want to comply, and they don't have to. And we say the average case of the average cost of a mitigation is around $3,000, but I've heard anywhere from 1,000 to 5,000 for different houses, and any dwelling can be mitigated, whether it's a condo on the 23rd floor or a single story house or a multiple story house, but it does cost money. And I think when we're looking at rental units and HUD housing, we get a lot of calls where they have elevated or slightly elevated levels of radon, and the landlords don't want to pay the money to do anything about it, and we can't force them. And so that's one of the issues. It's kind of a cost and low income housing and rentals. If you rent a place, you can't do the mitigation yourself, probably, and you wouldn't want to, and you wouldn't want to pay for it. So then it's a landlord tenant issue. I hope that helps with the question. Thank you.
Thank you, Michelle.
Condos and homeowners associations, sometimes similar type of issue.
Yeah, exactly. And it's interesting in condos, because a lot of times what we would like to see is if a condominium has elevated levels, you kind of go in and attack the entire thing as a whole and decide how you're going to handle it, because you go in mitigating unit by unit and it can change the levels in other units. So it's better to actually look at it as a whole, but I really don't think they do that in most cases, unfortunately. And so it's just a unit issue that they're dealing with.
We have one community who came across that they didn't want us to do radon screening in that community because of the implication that there might be radon exposure in those homes. And this was a affluent community. So
I've heard that, and I've heard that more about the affluent communities too. So that's a really good point too. There probably, I don't want to point fingers or say anything, and it's just my feeling and what I've heard and seen, but there are certain people that want to close their eyes to it. And I mean, we deal with realtors too, and heard that some of them flat out say things like, no, Florida doesn't have radon. You could just open your window for a year. You'll be an hour a year. You'll be fine. So yeah, when it does come down to making money, there are certain people that would probably like to close their eyes to the issue. And that's something we all have to deal with. You're right. Good point.
Yeah, rental properties, it's always a huge barrier for everything, remediation that we will like to address. Previously we talked about a mold, and that's another thing. You can live in a rental property and be having a very interesting relationship with the mold, and you try to do something and there's nothing, there's no law that makes them kind of prompt the landlord to do anything about it. Not even if you try to say I have a chronic condition, or I have this or I have that. It just unfortunately, but you know, it's part of society, I guess, you know, living in rental property versus you know, private property. So does anybody has any other question? Just make sure and that when we're gonna get all these links that Tim and Michelle and Chris added to our chat. So to the minutes, you know, and for the attendance. So you know, if you need more information about this, and if you live here in Florida, you can have access to these resources about radon. And as we mentioned at the beginning, this and it was posted on the flyer that we have one CEU for attending today's presentation. So after the meeting, we will have send Dr. Nowakowski will send a survey via email. So you can, you know, answer this email and you can have your CEUs accredited. Next Lunch and Learn will be next November, and it will be with Chris Duclos and Diane Neidhart from the Florida Environmental Public Health Tracking. It was rescheduled from September, where they couldn't have it because we had a Hurricane Ida coming through Florida, giving us a visit. So I encourage you to come to this webinar. And this one, if I'm not incorrect, it has a one chess credit and one CEU, isn't it? Okay. So see you next Wednesday, November 1st. And thank you for coming here. Thank you, Ken, for your presentation. Again, thank you for your work here at the Florida Asthma Coalition. And thank you, everybody. If you don't have any other questions, yes. Okay, so we'll have a few minutes of your lunchtime. Bye. Miss Deborah.
Bye. Thank you, everyone.
Miss Deborah,
Bye-bye.
can you
Thank
stay?
you. Sure.
Thank you.
Hi, thank you, everyone. Thank you,
Bye.
Ken.